I first heard about Dental Home when my previous dentist retired, and Dental Home came into the same location where my previous dentist was. And being a creature of habit, I wanted to stay exactly where I knew how to get someplace. As I've been aging, I've been noticing more gum sensitivity and occasional bleeding with my gums, and food getting stuck between some teeth, and just general achiness, and I thought I'd better address this now sooner than later. I felt comfortable after my first consultation. It came at a bad time for me personally, with a lot of things going on in my world at that time, and I had to put things off for about a year. And I worried about that for the entire year because I had an idea of what it was that was going on. How you explained the treatment process was amazing and scary because it was something that I had never heard of before. And when someone says the word laser, it kind of puts me a little bit on edge because I've worked with lasers before and I know how tricky it can be. But I felt that I was very well informed about what was going on. I'm also on Medicare, and I have another insurance issue, or an insurance carrier, and the people in your office were able to take all of that and take a couple of days and figure out what would work and what wouldn't work and what would be the best option. So I understood that there was also an opportunity that I could finance things on my own, but I prefer not to do that. There's a certain amount of anxiety that goes along with something like this, but everyone at the office was calm and collected, and I've been very cognizant of listening to what the dentist and the technician or the assistant say to each other. Having been a nurse, I listened to those kinds of things, and I felt that they both felt comfortable in their roles and what they were doing. So that made my comfort level much better. I'm very happy with the way I was treated post-procedure as well as during the procedure. Actually, the pain, there's no pain, and there's no discomfort anymore. But based on my experience, they know what they're doing, and there were no surprises and no questions about the talents of the individuals involved. My understanding of the LANAP procedure is that its target is to reach deteriorating tissue or infected tissue below the gum line, and the laser takes the place of actual cutting, and the laser goes down along the side of the tooth and cleans out the debris that's there from infection, and around the base, the roots of the tooth also. And then the procedure actually relies on blood clotting to help seal things rather than stitches. And I think that's, from my understanding, that's why there's no rigorous brushing and no flossing and certainly no water picks, because you don't want to disturb the natural process of the clotting taking care of sealing the area. I definitely like the idea that there was no cutting and no sutures, because I've had work done on my mouth previously for years, actually for most of my life, because of various things. And a couple of the things that are the most annoying, and it sounds like something very minor, but it gets to be annoying, are the little flecks of the stitches that you feel, and how I would push my tongue around there and make them probably even more irritated. And it was always on my mind because those stitches were there, and just constantly a reminder that I had had gum surgery. I wouldn't think that there's any question that I would recommend somebody to have a consultation about it, because I felt my consultation was so thorough, and it turns out was spot on. And I know that people get very nervous about going to doctors and dentists and those kinds of things, but I think that the comfort level that I had coming out of my initial consultation and then going through the procedure and then follow-up all meshed together, and there were no surprises. So I would encourage people to at least get a consultation.